Hello, the title of our project is Connected Healthcare, Impacting Health Outcomes Today and in the Future. We're going to be focusing on remote patient monitoring and wireless sensor technology and how it can impact different stages of life. Team members are Young Kim and Stephanie Lee. So what is remote patient monitoring? Remote patient monitoring is a healthcare technology to enable the monitoring of patient conditions or vital signs. It allows physicians and caregivers to track the patient's condition outside of the hospital setting, identify risks, and intervene in real time. It helps reducing hospital stays and hospital readmission rates and offers a convenient alternative to visiting a doctor's office, which lowers healthcare costs. It is also proved that when compared to patients who were not monitored remotely, patients who used remote medical monitoring technology had improved health outcomes. The remote patient monitoring market is poised for robust growth in the years ahead. It's been predicted that the wireless wearable sensor market in consumer healthcare will be worth $47.4 billion by 2020. Remote patient monitoring and medical sensors have applications for many types of patients, from infants to the elderly. In this presentation, we will walk through a few examples of how these technologies are transforming healthcare. Infants are particularly vulnerable because they have a weaker immune system than adults. If a baby is premature or has a congenital heart disease, the baby needs extra care and support. New monitoring technology and sensors can assist in this and go far beyond the traditional baby monitor. One example is TempTrack, as seen in the picture, which is a continuous remote temperature monitoring system by Blue Spark Technologies. This Bluetooth-connected sensor continuously collects real-time temperature data, and a caregiver can access the data from anywhere on their phone or tablet. So this is great for working moms who want to make sure their babies are okay. They can log into their phone and check to make sure that their baby is doing all right temperature-wise at any time. MC10's BioStamp is a similar wearable technology that can be applied to the skin like a Band-Aid. It stretches, bends, and twists, and it also moves with the body and is waterproof. The sensors collect real-time biological data such as body temperature, heart rate, brain activity, exposure to UV rays, as well as hydration levels, and send it to other digital devices. My immediate thought when I read about this was when children are out at the beach or outside at the pool in the sun for a long period of time. This can keep track of how much UV rays they're getting exposed to and to make sure they're staying hydrated at all times. The next example of a patient group benefiting from remote patient monitoring is children or young adults who have received transplants. Usually these young patients have to visit the hospital twice a week for a month for follow-ups after spending a month or a couple of months in the hospital already. But using a remote patient monitoring kit can save travel time for the parents and costs for hospital visits, allowing them to resume normal life as kids. Vivify Health offers a kit consisting of a 4G tablet and wireless health devices that can monitor blood pressure, blood oxygen levels, weight, and other vitals through Bluetooth. You can see in the picture the young child on the 4G tablet. Children's Medical Center in Dallas is using this technology for maintaining and improving post-operative care for transplant patients. The remote patient monitoring is combined with one-touch video conferencing for virtual visits. Diabetes affected 29.1 million Americans, or 9.3% of the population in 2012, and 1.4 million Americans are diagnosed with diabetes every year, according to the American Diabetes Association. Google is partnering with pharmaceutical company Novartis to develop a smart contact lens with an embedded glucose sensor, which will help monitor people with diabetes by measuring their glucose in their tears. Censoring on contact lenses are triggered by eye blinks. Sensors are embedded between two soft layers of lens material, and a pinhole in the lens allows tear fluid to seep into a sensor and be used to measure blood sugar levels. Data will then be transmitted to the external device. When blood sugar exceeds a certain level, the app notifies the patient and caregiver instantly to act or to contact a physician if the situation is serious. Many diseases are treatable with proper medication, but when an individual doesn't follow the plan as prescribed by their physician, adverse health complications can arise. Remote patient monitoring can be used for helping medication management and adherence. The MedPod by DiaMed is a cellular, portable medication dispenser and communication device that connects to the secured HIPAA-compliant data cloud. The patient is able to video conference with their caregivers, providers, and pharmacists. Real-time medication adherence of place, time, and the exact medication taken by the patient are recorded and transmitted into hospital electronic health records, pharmacy information systems, and payers' IT systems. When patients fail to take their medication, the MedPod sends alerts to caregivers and healthcare providers. In 2014, about 1 in 7 Americans were 65 years or older. This will increase to 25% of the total population by 2060. Older Americans face unique health challenges like Alzheimer's, gait instability, urinary incontinence, and arthritis. Remote patient monitoring can be one solution to help address the specific needs of seniors. The Go Live Assist app and Go Live Wear sensor device by GoCity Solutions are examples for this technology. The Go Live phone app uses a smartphone sensors to track gait speed, walking asymmetry, overall activity levels, and speed of sitting to standing transitions. It analyzes this data to determine the risk of falling and abnormality. If the user falls, approved caregivers automatically receive alerts and seniors' exact coordinates. The solution integrates Bluetooth-powered biometric devices like oximeters, weight scales, and blood pressure cuffs to track health data trends and alert healthcare providers to abnormalities. For elderly persons with Alzheimer's, it provides real-time information of seniors' location, automatic notification whenever clients arrive at or leave their location to approved caregivers. Clip-on sensor devices is a fall detector and emergency button device that can be worn underneath clothing, and it communicates wirelessly with the phone app. So in conclusion, here are a couple of discussion questions for you to think about. The first one is from Young. It is remote patient monitoring is still in its infancy. We have introduced a number of technologies that are available today or in development for deployment in the near future. However, the potential of smart connected medical sensors to transform healthcare is enormous. How do you envision remote patient monitoring will have evolved by the time you reach your senior years? The second question is from me, Stephanie. Innovators are coming up with more and more technology-based instruments to make healthcare quote-unquote convenient. Do you think that such advances should be covered by insurance or considered luxury items and be paid for out of pocket?